Hi, this is Director Hassan, fertility physician in the Dallas-Fort Worth area, as well as author of Miracle Baby, A Fertility Doctor's Fight for Motherhood, and the Fertility Manual, Reproductive Options for Your Family. I'm so delighted today to have Dr. Samraza with me today. She is a cardiologist here in the Dallas-Fort Worth area. Welcome, Dr. Raza.
Thank you so much for having me. It's such an honor to be with you today.
Absolutely. I'm delighted that you are here with me to discuss heart health in the pregnant woman and women who want to get pregnant. But first, let's talk a little bit about you, yourself, your practice, and your passion for taking care of women.
Thank you so much. I just want to thank you again so much for the opportunity to spend some time with you, especially during this pandemic. We're just definitely connecting in some different ways, which is exciting and fun. So my name is Dr. Samraza, and I am a board certified cardiologist, and I work in the Dallas-Fort Worth area. My practice is in an area called Plano, West Plano. And so I basically have a non-invasive cardiology practice where I take care of both men and women. I have a background in advanced cardiac imaging, so that includes both cardiac CT, which is a specialized imaging test of the heart, along with advanced echocardiography, which is ultrasound scan pictures of the heart. And I also have a big focus on prevention of heart disease as well as women's heart health, which I'm just so delighted to have the opportunity to talk to you all today about this.
Fantastic. And you know, one of the things I see a lot as a fertility doctor are patients who want to get healthy before they get pregnant and they want to know how to stay healthy during pregnancy. Can you enlighten us a little bit about how can one lead a heart healthy diet, and what does that mean for pregnancy, and how can we extend that to women who want to get pregnant?
It's a great question, and I'm so glad you asked because it's definitely something that we don't focus on in traditional medicine a lot. And I'm sure you see a lot of these types of people, which is wonderful, you know, so it's a great question. So the things that we can focus on are relating to the condition called hypertension, so high blood pressure. So as a woman, I'll focus on women, although the advice also is relevant to men, but as it relates to women who are seeking infertility treatments or just those who are interested to know more about their heart health, I think knowing your numbers is one of the most important things that you can do. So what do I mean by that? I mean, what is your blood pressure number? So when you get your blood pressure checked at a doctor's office, or you've been checking it at home, or if you have a family history of high blood pressure, maybe mom or dad took medicines for high blood pressure, you may have some risk factors for developing high blood pressure in the future. And so knowing your numbers is a great way to stay aware and to kind of focus in on prevention of heart disease as it goes forward. Now, according to the American Heart Association and the American College of Cardiology, the guidelines for blood pressure actually have changed, and not many people are necessarily aware of these changes. And they've been published and they're in the guidelines. So we define high blood pressure as a blood pressure greater than 130 on the top number, 130 millimeters of mercury, over 80 on the bottom number. So lots of people may be out there and thinking, you know, my blood pressure sometimes runs, you know, in that range. So if it's consistently elevated like that, then you may have underlying tendency towards high blood pressure. So knowing your numbers is one big thing that you could do to try and prevent heart disease risk. And also gearing up yourself to be in the best shape possible to undergo any fertility treatments or pregnancy that might follow on from that. The American College of Obstetrics and Gynecology, ACOG or ACOG, as you're familiar with, also defines blood pressure as it relates to pregnancy. And I'm sure you're more familiar with this, but from a hypertension standpoint, thinking about people's heart, we have some guidelines and numbers that we look at when someone's thinking about getting pregnant, or when they're in the initial first stages of their pregnancy, and how best we can manage that with either lifestyle, diet, and also sometimes need for medications.
Oh, fantastic. That is really good information. You know, one of the questions women ask me about too in terms of hypertension is, are there any good drugs that are safe in pregnancy? So they're always weighing the risk. Should I take medicines because I have high blood pressure? Will that affect my pregnancy? Can you tell us a little bit about that?
It's a very good question. And as you know, we try to avoid really a lot of medications during pregnancy as much as we can avoid, because as you know, we're trying to be as safe as we can be. Now, I'm a big proponent of lifestyle and wellness, and so I try and focus a lot on lifestyle interventions as much as possible. So that includes things like maintaining a healthy body weight, either that's during pregnancy or pre-pregnancy. Probably it's more important to kind of watch your diet, eating a heart-healthy diet, including a low salt diet. Actually, that's a real big one. So we all eat too much salt. You know, it's in all of our diets. In the American, even in the European diet, we have too much sodium. And so paying attention to nutrition labels is really important, along with thinking about some specific medications. Now, a couple of medicines that come to mind are things like labetalol, people may have heard of. It's a particular medication that some people may start during their pregnancy. It's considered to be safe. And then there are a couple of others, kind of older medications that we've had around for many years that have a good safety profile that we can use. But that's a joint decision between, you know, a fertility specialist, the patient, sometimes their primary care doctor, along with a cardiologist who has expertise when it comes to thinking about high blood pressure. So we make those decisions as a team.
Fantastic. And you mentioned weight loss. Can you tell us a little bit about what's a diet to follow if you're trying to get healthy before you get pregnant?
So really good question. I would recommend the same diet as what I'd recommend to someone who's not necessarily thinking about getting pregnant, and even for men too. Now, we definitely want to be following a heart-healthy lifestyle. So diet and exercise are two components of that. In terms of the diet, I recommend that in terms of cardiology literature, so we know about this thing called the Mediterranean diet, which is essentially made up of fresh fruits and vegetables, low salt, like I spoke about with the sodium, incorporating a portion of fruits and vegetables, but also meat is, you know, a part of that diet. So I recommend grilled meat, where possible, avoiding fried foods, obviously avoiding junk foods and things like that. Pre-packaged and processed foods can carry a lot of extra calories as well as saturated fat, which can be, you know, can not help us lose weight. And then adding a portion of fish in is also a good incorporation into the diet. So those are just some basic things. Now, when it comes to diet, I'm a huge foodie, so I try and practice what I preach. You know, it's really difficult. I tell myself every day, and it's really just about being as healthy and kind of focused on mindful eating, as well as some degree of calorie control. So you want to think about what you're eating in a day and try and vary it so you stay interested, but focusing in on the healthy types of foods. So things that don't contain a lot of saturated fat or are fried. You know, it doesn't mean that you have to necessarily go on and change up your whole routine, but I would say to add in some of those principles, and then you'll sort of follow and you'll feel better, and that may help you lose weight. There aren't any specific recommendations other than trying to maintain a healthy body weight. So we look at the body mass index, which is the height to the weight ratio that we look at for everybody. Now, in pregnancy, the demands are a little different. So definitely would recommend to consult with your OB or your fertility specialist about specific needs that you may have. And then definitely multivitamin supplementation, along with adding in folic acid in terms of both your diet through fruits and vegetables, as well as other supplementation that you may well recommend in your specialty.
Oh, that's such good information for patients to hear. Tell us a little bit more about exercise, and do we really have to do a lot of vigorous exercise? Patients are always worried if vigorous exercise can make pregnancy more difficult. Tell us a little bit about exercise.
I always tell people to do what fits with your lifestyle. So exercise doesn't look the same for two people. And especially when you're pregnant, you know, you may well have other symptoms of pregnancy that you may not wish to be up there doing high interval training, and it may not necessarily be safe for you either. So what I recommend, according to the American Heart Association and our cardiology guidelines, we recommend 30 minutes of exercise 5 times a week for people who are generally for their general daily prevention, you know, for heart disease. And in pregnancy, what I would say is just, you know, moving and staying as active as you can as your symptoms allow. Now, everybody responds differently to pregnancy, and there are so many symptoms. I myself have had 2 children, and, you know, they have about 2 years age gap between them. And so I remember those days, and definitely motivation can be difficult at times, but I'd say just keep moving, maybe stick to 1 or 2 activities that you really enjoy, whether that's yoga, or if it's, you know, walking, taking a walk outside, choosing a safe activity, especially given the current pandemic. like is really important to consider, but just choosing something that you find that you can stick with, that maybe will help you as you progress through your pregnancy. Generally staying active is a good thing, and I think especially during the end stages of pregnancy, you know, being active can actually help with your overall health and your wellness.
This is really good information, particularly in the time of COVID-19 and being at home quite a bit. People are struggling. What should I eat? What shouldn't I eat? And those frequent trips to the fridge and the pantry and trying to stay healthy. So this is really good information. In terms of cooking, I'll tell you, I've personally learned to do some different cooking now to have a little bit more time in my hands, follow new recipes and new ingredients. So this is all fantastic information. Is there anything else you'd like for our listeners to know before we close?
No, I think, you know, consult with your doctors, and everybody's very different. So some of the things that we've spoken about don't necessarily relate to everybody. So it really is an individual specific decision, you know. So definitely consult with your doctors and do what feels most comfortable. Some of what I've described is kind of basic principles when it comes to what we know about heart disease and prevention of heart disease within cardiology, and as it relates to pregnancy. If anybody's interested, I blog about cardiology and wellness prevention, so you can find me on Instagram at Dr Samraza, and I'm sure you can share that information, and really reach out to your doctors and ask these questions, and we'd love to help you.
Fantastic. Thank you, Dr. Raza, for being on our show today.
Thank you for having me. It's nice to see you.